Ayun, good morning. Bibiyahe tayo. Afternoon na pala. Good afternoon. Bibiyahe na tayo. Umaga na tayo.
Now it's time to process this with your host, clinical educator Casey Zarnowski.
Ganda nga po.
Hello, and welcome to Process This podcast. My name is Casey Zarnowski, and I would like to start with a big thank you to all of our local listeners and a big welcome to our new fans. We have a fun and intriguing and informative guests lined up in the coming months, so make sure to look out for our regular guest lineup announcements. Surgical instruments require constant care for use, through storage, and back to the procedure area. This care saves healthcare systems money and, more importantly, ensures that surgeons have the tools that they need when they need them to improve patient outcomes and often save lives. We know from manufacturers' IFUs and from peer-reviewed research that the care of surgical instruments, both simple and complex, begins at the point of use. But how can we, in sterile processing, talk with our procedural partners about point-of-use treatment of instruments? Today on the broadcast, we are talking with Pam Kika, who is the Assistant Director of Sterile Processing
Ayun, good.
and has spoken on the national stage on this topic.
Good afternoon.
We are
Today
excited
is
to welcome Pam
July
Kika. So let's dive
22,
into our interview.
Tuesday, 2025.
Tammy, thanks for being
Time
on
check
today.
is
Thank you for
18:45
having me, Casey. I'm
in the
excited to be here.
afternoon.
Good, it's always a pleasure. Tammy, tell us a little bit about yourself and about your career trajectory.
Casey, I've started off back in
It's
1997 at Roman Hospital in
6:45
Illinois as a
ng
surgical
hapon
technologist.
dito sa Abu
And
Dhabi.
we were a smaller community hospital at the
Tayo sa
time.
stoplight.
So a lot of us surgical technologists.
Windy siya,
had
humid.
would
Windy na
serve in
humid.
surgery and
May hangin pero
assist, but
mainit
also
yung
work
buga ng
in
hangin
sterile
sa
processing.
paligid.
So it was there that I
Kaya
discovered that ferries didn't magically assemble instrumentation and just deliver it to us in the middle of the night, as I thought when I was a student. So held a couple of different roles. I did some intraoperative neurophysiological monitoring for a while, taught surgical technology at our local community college.
dito tayo ngayon sa
But
stoplight
always kept finding
versus
my way
stoplight
back
sa
to sterile processing.
crossing ng
I've been a
Alpala and
frontline
Najra
device
Street
technician. I've been
dito
a
sa Abu Dhabi.
supervisor, an STD
Alpala
manager,
and
an
Najra
STD
corner.
perioperative business
Ngayon,
manager,
turn ako.
and now a system director in Ohio
Pinig tayo
Florida.
nitong ano.
That's very cool. For so many people that we talk to, once that passion gets in your heart, you always keep coming back to it, don't you? Once you understand how you can care for patients in such a special way, you just can't get away from it. You always kind of keep coming back to it, and it becomes really fascinating, doesn't it? I love that.
It really does, and it's been wonderful looking at sterile processing now and compared to what we know today and what we knew back then, and the acknowledgement that's growing in our industry it's been a great thing to watch. People are finally realizing we're the foundation of that house of cards of the many things that can go wrong with patient care, especially during times like surgery. And if we don't get it right, you can have the most talented surgeons, the best nurses, and the best surgical technologists. And
Green
if
light.
they fail. So it's great to see the industry being recognized as well as it should be.
Exactly. That's great. All right, well, let's dive into our topic today. First of all, let's talk about point-of-use cleaning. Do we say point-of-use cleaning? And if not, why do we try and avoid that term these days?
I think there's been a big push to move to point-of-use cleaning. That there's been lots of terms like point-of-use decontamination used to be a big one, right? I do agree with using point-of-use cleaning because it is what's in the manufacturer's IFU. I do wonder, however, if there's not a better term than cleaning, because we really only want to clean in the decontamination area, right? And point-of-use decontamination also kind of gives the I'm cleaning in the OR vibe. And in talking to our OR partners, I'm hearing from them, well, if you want us to clean at point of use, then we're going to need brushes to flush out, rush through the lumens, and to get into those acetabular reamers, I need the special brush. But as far as a different term, point of use biofilm prevention, solution maybe, but that's a mouthful, right? But I do think having the point of use and using cleaning is establishing some roadblocks for both us and
Stop
the
light.
operators.
Dalawang stop ako nito dito
For
sa
sure.
stoplight
Can we
nito.
define point of use treatment?
Mabilis mag-ano dito mag-turn.
I think we can, and I do love the point of use treatment. I think we can, and I think what we have to go back to is reminding our OR partners that this is not only an AAMI guideline. I think there's a large misunderstanding right now that there's been now I will say in 96 when I was in Surge Tech School, 94, 95, and 96, we were always taught point of use, and you could never hand an instrument back in your clinicals that was visibly soiled, or you would never hand a needle holder back to a surgeon with an old suture attached to it, right? So I'm not sure where that
Parang narinig ko na
happened
to.
or if I feel because Dr. So-and-so, you can't get everything clean and you can't get rid of all those
Products, because that happens where maybe we'll do a trial to decide which kind of pre-treatment we want in the OR, and to look at the technical claims aside from the marketing while we're doing this testing to make sure we're getting the right product for ourselves.
The marketing brochures are for people like me, system directors that are, looking for solutions.
Welcome to Process This, a podcast for the sterile processing community. The Healthcare Sterile
Narinig ko na yun.
Processing Association,
Episode na yun.
HSPA, invites you to log on, listen, and learn. Now it's time to process
green
this
light, pero
with your
tatap.
host, clinical
Bilis ng
educator
oras,
John
6:50
Wood.
na kagad. Green light pero naabutan ako ng stoplight nito. Mabilis ayan o. Kaka-start ko pa lang halos umandar
Welcome to the Process This podcast.
Nag-ano
Thanks for
kagad.
tuning in. I
Red light
hope
ulit.
that you are doing well today. We have an exciting podcast for you. It's all about IFUs, instructions for use. So today we're talking to Randall and Harold from Steel Co. Bellamed.
Grabe yung bagyo sa
And
Pilipinas.
again,
Ano?
like I said, it's all about those instructions.
Daming
for use.
bagyong
Randall is going to share
ilang bagyo na,
some
dalawa na yata pumasok.
and experience,
Pero parang
what to
sunod-sunod.
look for, and how to navigate.
Halos baha ang Kalakhan.
That involves reading,
NCR,
understanding,
Greater Manila.
and essentially following the
Kalakang
IFUs,
Maynila.
which is a big part of what we do.
Pati
at
mga
Sterile
probinsya.
Processing. It's
Ilang,
our
buong halos buong
responsibility
Luzon.
as professionals to make
Bisaya,
sure
awan ko lang
we're
kung
doing
meron
our
din.
part.
Antiki, parang meron nagbaba din ng lugar sa Pilipinas.
So
No?
we have a jam-packed show.
Grabe ang
But
sa
before we
atin.
talk to Randall
Sa
in,
mga ng panahon talaga.
let's get into the segment.
Ano pa
What's
lang
on
ngayon?
my mind?
July pa lang, July, August, September. Grabe yung ano. Sama ng lagay
What's
ng
on my
panahon.
mind? So to follow in our theme of IFUs, I decided to pull up a random instruction for use using a search engine. Now I'm going to get right to the point here. So are you following the IFUs for every single instrument in your department? Are you taking the time to review each instrument and their specific instructions, if any? To make my case,
Humid ngayon dito sa Abu Dhabi.
some of the instructions that I found for a flexible intramedullary reader. Now, these instructions are actually pretty good. They're very detailed, but I'm not going to read all of the instructions in the entirety for time's sake. I'm just going to
Green light.
focus on the cleaning instructions for this segment. But just note, that doesn't mean that the cleaning instructions are any more or less important than the other instructions provided. Alright, so the instructions start off with cleaning tools and accessories, things that you're going to need. And it talks about water, which is pretty interesting. It just gives you the ranges for cold and hot water. It says to use deionized, DI, or reverse osmosis, RO water. It talks about the cleaning agents, and it lists the enzymatic cleaner and neutral detergent, which will be important later on, so note that. It tells you some of the brush accessories that you need, various sizes, pipe cleaners or nylon bristles, a syringe, absorbent low linting, disposable cloths or equivalent, soaking pans, and interesting. Hydrogen peroxide. Again, we'll talk about that here in a second. It also talks about the equipment that you're going to need, medical air, ultrasonic cleaner, automated washer. So again, this is just a random IFU that I pulled off that I was able to find. And it starts off with point of use and containment. So first 3 steps. Follow your healthcare
Humidity.
facility use practice. Okay, that's great. Keep the device moist after use to prevent soil from drying and remove excess soil and debris from all lumens, surfaces, crevices, sliding mechanisms, hinge joints, flexible areas, and hard to clean design features. Great. If you know, flexible reamers are in itself hard to clean designed features, so important to note. Suction or flush lumens with a cleaning solution immediately after use, and then follow universal precautions and contain device in a closed covered container for transport to the central supply. Now these are good instructions. You know, I hear a lot of people talk about, you know, the operating room doesn't do a pre-cleaning. They don't do their part, right? Well, here's some instructions in this IFU. You know, if you could bring this to the operating room, it says this is part of the instructions for cleaning. The responsibility for care for this instrument are right here, and this is part of your part, right? So just good information in your IFUs to state your case about why pre-cleaning is so important. All right, so now we're going to go through the manual cleaning steps, and this, you know, point of use is 1 through 3. Manual cleaning starts at 4 and roughly through 14. So there's 14 steps that we're going to look at in this portion. Now I'm going to jump ahead just because I briefly skim these instructions. And under the automated cleaning section, so this is important. So a lot of people ask, you know, do I need to manually clean this instrument if I'm going to use a washer? So for these specific instructions, under the automated cleaning, it says a note. It says all devices must be manually pre-cleaned prior to any automated cleaning processes following steps 1 through 9. Right, so we have to follow steps 1 through 9, which again, the first 3 was the point of use, cleaning and containment, and then 4 through 9 is going to be those required steps for cleaning. And then it also notes that steps 10 through 14 are optional but advised, right? And we'll get to the advised here in a minute, because we definitely want to look at that and make sure that we are doing those steps as well, or at least looking at them and seeing what is beneficial for cleaning this instrument. So manual cleaning, step 4. We'll start with disassemble all devices as warranted per the instructions, manufacturer instructions. Okay, yes, disassemble devices makes sense. Now here, rinse devices under cold running tap water for a minimum of 3 minutes while wiping off residue. All right, so we have a time requirement here. If a surveying agency is in your department, asks to see these IFUs and expects you to follow them, right here we have a specific instruction. 3 minutes of running this device under cold tap water, wiping off
Tumatawid
the
ng
So you're
alanganin.
going to have a clock, you're going to have a timer, something to verify that you're doing this for the amount of time stated in the instructions for use. Okay, so we're wiping off residual soils and debris under that water,
Oh,
actuate movable mechanisms, and flushing all lumens, cracks, and crevices while rinsing. If the device has a flexible areas, which this one does, bend or flex the shaft multiple directions while rotating to ensure it's adequately rinsing off all surfaces. All right, so that's just rinsing. Step 5, then moving on, prepare an enzymatic cleaning solution per manufacturer's instructions, including, and it states here in the instructions, using the dilution for the concentration, water quality, temperature, and immerse the device in soap for a minimum of 10 minutes. All right, we have another time requirement here. So 3 minutes under cold water, now we're adding 10 minutes. Okay?
tawid ng ano.
While in the solution, use a soft bristle brush to remove blood and debris to the water. And so it talks about some of the cleaning there. If it has any sliding mechanisms, hinge joints, make sure to identify those. Lumens, make sure you're using a tight-fitting nylon brush or pipe cleaner while pushing in and out and twisting motion to facilitate removal of debris, ensure the full diameter and depth of the lumen is accessed, and then flush the lumen 3 times minimum. All right, so another requirement, specific requirement, we're using a nylon brush or pipe cleaner, twisting motions, and then we're flushing with a syringe. This says the syringe is minimum solution of 60 mils for three times. Okay, now if the device has flexible areas, again it talks about that. So again, very specific instructions. Next, it says remove device and rinse, agitate in cold water again for another 3 minutes. So we had 3 minutes cold water flush, 10 minutes in our soaking enzymatic solution. Then we have flushing for a minimum of 3 times with a 60 ml syringe, and then back in the cold water rinse for 3 minutes.
Yung
So our
babaeng
time is
foreigner.
adding up, and this is just for one
Tatawid yung
device,
naka-red light
right?
yung
This is just
kanyang
one instrument.
mabanggaan ko
Okay,
pa.
moving on. So next it says prepare
Haba
a
naman ng
neutral
dito.
detergent cleaning solution
Haba ng...
per the manufacturer's instructions. So not only do we have to use an enzymatic, but now it's calling for a neutral detergent cleaning solution. All right, and it says in these instructions, immerse for 5 minutes, minimum of 5 minutes.
Tapon muna ako ng basura.
And again, we're using a
Magandang gabi
brush to
ulit
clean
at
it.
ingat-ingat kayo
So
mga
not only are we using an
kapatid, mga
enzymatic solution,
ka-TGP,
but now we're using a neutral
sa ating mga
detergent.
kaibigan dyan.
Right, and there's
Ingat-ingat
time requirements
sa
again. These times are adding up.
lalo
So
dyan
it's
sa
important
Pilipinas,
to look at
maulan
these instructions.
sa mga panahon.
It talks about in this step